recent story of one of my patients was that he was in recovery for a couple of months, was doing good. He felt like he needed to have someone in his life. So he had a girlfriend that was coming to him regularly. He suspected that the girlfriend was using drugs. He tried his best to stop her from using drugs. On the day he finally was arrested and sent to jail, he called the police on his girlfriend, hoping that they would take her away. But unfortunately for him, he too was high. So when police got in the house, they found drug paraphernalia. They arrested him for assault on a female. And he went to jail. And when this was brought to my attention, to help the parents, I encouraged them to let him stay some few more days in jail. And that taught him a lesson before we finally sent him into residential treatment. So, relationship in recovery is very, very risky. And I've always cautioned my patients to focus on themselves first, rather than trying to incorporate someone else's issues into theirs. So sex could awaken the sleeping giant in the addict. The sleeping giant is the backlog of unmet emotional needs from previous relationship. Unmet emotional needs reside in the unconscious and are sealed off from awareness. At the least 1 year of sobriety and relationship abstinence are necessary to allow the recovering addict to deal with his or her own emotions and build on self-awareness and take control of his or her own emotions. The recovering addict, rather than relying on an external source for relief or emotional gain, which is what he or she is accustomed to, he or she begins to look internally and to rely on oneself as a source of emotional nourishment and strength. The most important relationship is with oneself. This concept poses a complete paradigm shift to the recovering drug addict. If the necessary amount of time to grow the relationship with oneself hasn't lapsed, chances are that the recovering addict will do whatever he or she has been accustomed to during crisis. The recovery addict will look outside of self for relief or to make up for what is missing, that is, go back to use drug or drink. And that would be my submission on relationship in recovery.